Washing my hands. Hello, my name is Nicole. I'll be the nurse practitioner doing your interview as well as your head, eyes, ear, nose, throat exam and your range of motion exam. Do you have any questions before we start?
No.
Okay, so the first thing I'm going to do is I'm going to kind of just do a general overview to make sure I don't see any gross abnormalities. I'm looking for any deformities. I'm looking for any rashes, any redness, any asymmetry right off the bat, and I don't see any. I am then just going to move it. Can I touch your hand? I'm going to just be checking the skin texture as well as temperature and turgor with the tent test, and that looks fine. So we're just going to start at your head. So I'll be just inspecting the head initially. So I'm looking to make sure there's even hair distribution if there's hair. If there's no hair, like in his case, we're going to be looking for any lumps, bumps, any rashes, any abrasions, any molds or nevi that are here. I am also going to feel just to make sure I don't feel anything that I'm not seeing. And everything looks okay. Everything looks okay there. And so then we're going to move down. I'm going to look at your eyes and your eyebrows. So I'm looking for hair distribution at the eyebrows as well as the eyelids. I'm looking at the eyes to check and see if there's any asymmetry. Excuse me, if you could sit up for me. If there's any asymmetry. I'm also looking for any redness, rashes, edema in the eyelids or around the eyes. I'm going to press gently just around the orbits to see if there's any crepitus or any pain, any pressure, sir.
No. Very
good. I am going to look at the conjunctiva and sclera in both and look up for me. Very good. Same thing over here. Look up. Very good. And also checking the lacrimal glands. And everything looks fine there. Okay, I'm then going to move down to the nose. The nose externally, I'm looking for, again, any changes in skin texture, any lumps, bumps, rashes, any lacerations. I'm also looking for symmetry. Everything looks okay there. I am going to tilt your head a little bit back, and I am going to pull the bridge of your nose up. I'm looking at inside each nair. I'm looking at the turbinates. I'm also looking to check the mucosa of the nose, and that looks nice, pink and moist. I'm looking for any foreign bodies that I might see there or any drainage, and I see none. I did also check the nasal septum to make sure that's aligned and not deviated. Okay, and I'm just going to look at both of the ears. So we're going to do an external inspection. We'll leave the internal exam for a later date. So we're looking for any swelling, redness, any drainage, any foreign bodies, any lumps, bumps that shouldn't be there. And those both look fine. Very good. I am going to just go ahead and check your sinuses. So we're going to check the frontal sinuses. Just gentle pressure to see if there's any pain there. I'm also going to do the same thing with the ethmoid sinuses as well as the maxillary sinuses. And everything looks fine there. Any pain?
No.
You're good. We're going to move down to the mouth. And again, we're going to check and do an external inspection first, and everything looks fine. We're looking again for symmetry. We're looking for moisture. We're looking for color, texture, as well as any lumps, bumps that shouldn't be there. And that looks fine. I'm gonna have you open your mouth for me and stick out your tongue. You say ah. Very good. We're looking at the tongue. We're looking at the oral mucosa to make sure. Are you okay?
Yeah, sorry.
To make sure that is pink and moist. You can relax for now. We're also looking at the tonsils to make sure there's no enlargement there, make sure the oral airway is patent, which it is. Great. If you could open again, I'm going to have you move your tongue to the left side and to the right. And if you could touch your tongue to the top of your mouth, tongue to the top, perfect. Okay, and I'm also looking at dentation and just the hard and soft palate to make sure those look okay as well. So everything looked fine there. I am going to just check your temporal artery, and I'm feeling it. Everything feels fine, nothing feels bounding. Okay, I'm gonna take a listen to both sides of your temporal artery. Okay, that sounds good, no bruit noted. Okay, again, that sounds good, no bruit noted. Okay, now I am going to look at your lymph nodes. So we're going to start with the pre-auricular lymph nodes. Then we're going to move to the post-auricular lymph nodes. We're going to do the submandibular lymph nodes as well as the submental lymph nodes. We're going to be checking the anterior cervical lymph nodes as well as the posterior cervical lymph nodes. We're going to move our way down to check the subclavicular lymph nodes as well as the intraclavicular lymph nodes, and those all feel fine. Did you have any tenderness when I was palpating them or no?
No.
Very good. I'm also going to be checking for JVD or jugular vein distension on both the left and the right side. I see no distension here. We're going to check this side as well. No distension. I'm also going to take a listen also to see if there's a bruit there. And that sounds fine. That also sounds fine. Okay, now we're going to be checking your TMJ. Very good. That feels fine to me. I'm going to have you open and close your mouth, and we're just open and close for me. Open and close. Very good. We're just checking to see that the jaw is aligned as well as to see if there's any popping or clicks with opening and closing of the jaw, and that sounds okay. The next thing I'm going to do is I'm going to be looking at your thyroid. So I'm just going to come to the side and sit a little bit behind you if you don't mind, and I'm going to be palpating both sides of your thyroid gland. That feels fine. I don't feel any lumps or bumps that shouldn't be there. Can you go ahead and swallow for me? Very good, and that feels good. Okay, so far that feels okay. Everything looks good. We're gonna go ahead and move towards the range of motion exam, okay? Again, I'm just going to kind of look at everything as a whole, looking for any lumps, bumps, deformities that shouldn't be there, and everything looks fine. We are going to be checking, like you said, the skin, just to make sure there's no change in temperature, no areas of redness or warmth or clamminess, no moles or rashes that we should be noting. And again, everything looks fine. Okay, so the first exam I'm going to do is I'm going to have you stand for me. We're going to be looking at your spine. Okay, so I'm going to have you turn towards the window here. Very good. I'm looking just for symmetry upon standing. I'm looking at the curvature of the spine. I am going to palpate back here, and definitely inspecting while we're palpating for all of the same things. So any rashes, any moles, checking the skin temperature and texture along the way, and that feels okay. We're going to have you do some flexion and some movement of your spine. So we're going to have you bend and do some flexion. So if you can try to touch your toes for me. Very good. Flexion looks good. While they're flexing, we're going to check here just the alignment of the spine, checking for things like scoliosis, and that feels good. You can relax. Stand up for me. We're also making sure there's nothing like kyphosis or lordosis upon the patient standing, and that looks okay. Now we're going to try extension of the spine. So I'm going to have you kind of stand here, and I'm going to have you just tilt back a little bit to make sure that spine can extend. Very good. Excuse me. Very good. And then you can turn towards me. Okay, we're going to try some lateral movement. So I'm going to have you you can put your hands on your hips, and we're going to try lateral movement. So you can go laterally to your left with your spine. Very good. Laterally to your right. Very good. And can you just kind of go in a circle, like a little bit of rotation? Very good. Okay. And you can go ahead and sit. Okay, we're going to be looking at your neck as well. So I'm going to have you do some of the same exercises with your neck. Okay, so the first thing we're gonna do is we're gonna check for flexion. If you can bring your chin to your chest for me. Very good, good flexion. Okay, you can bring your head you're gonna tilt your head back for me, kind of looking up at the ceiling. Very good, there's extension, relax. I'm gonna have you tilt just your head or put your ear to your shoulder on the left side. And this is gonna be lateral movement as well. Very good, you can bring it back to the midline. We're gonna do the same thing on the right side. Very good. Okay, I'm gonna have you just turn your neck. So you're gonna turn to the left side. Very good, and turn to the right side. So we're looking at rotation as well, and that looks good. Okay, we're gonna move down to the shoulders, and I'm feeling just to make sure everything feels good and is aligned. That looks good. While I'm here, I'm just gonna test the strength of your shoulders. Go ahead and lift your shoulders up to the sky. Very good. All right, and resist me pushing down on them. Very good, nice and strong. Okay, very good. So for this, I am going to have you do a couple of exercises. You can remain seated if you'd like. So I'm gonna have you do adduction, excuse me. So you're just gonna bring your arm away from your body. So just like this. So you're gonna start with the left side first. You can bring it away. Very good. And we're gonna have you do adduction, and you're gonna bring it right back to your body. Very good. All right, with that same arm, I'm gonna have you do an internal rotation. So bring your arm forward. Internal rotation. Very good. And external rotation, and bring it backwards. Very good. We're gonna do the same exercises on the right side. So again, you're gonna do adduction, bringing it out to your side. Very good. Abduction, bringing it back. Internal rotation, bring it forward. And external rotation, we're gonna do the backstroke. Very good. All right, we're gonna move down to your elbows here. Okay, so we're gonna have you just do flexion. So bring your hand up to your shoulder. Flexion, very good. We're gonna have you do extension, bring it back down. Very good. So right here, the way your hand is just up to the ceiling, that's great. That's supination. We're gonna have you bring it down and face the ground for pronation. Very good. We're gonna do the same thing over here. We're gonna have you relax. You can flex this arm up, flex. Nope, just flexion. So you're gonna bring it up, flexion, extension back down. Very good. So you are in pronation right now. I'm gonna have, excuse me, you're in supination right now. You're gonna pronate down to the floor. Very good. All right, I'm gonna have you, we're gonna look at your wrist. So we're gonna do the same type of exercise with your wrist. So you're gonna flex it up. So you're gonna point your fingers up towards the ceiling. Flex that wrist up, very good. And then you're gonna extend it down to the ground. Very good. We're also going to do inversion. So you're gonna kind of bring it in like this. Very good. And eversion out. Very good. You can relax. We're gonna do the same thing on this side. So up to the ceiling for flexion, down to the ground for extension. Very good. We're gonna invert. Leave that, just the wrist. Very good. And eversion. Very good. You can relax. We're gonna check your strength. Can you grip my fingers? Tight, tight, tight. Very good. That's very good. You can relax. All right. I'm gonna have you bring your arms up just like this for me. I'm gonna pull your arms towards me. I want you to resist that pulling. Okay. Very good. And I want you to then now pull me towards you with your arms. Very good. All right. Nice and strong. You can relax. So now we're going to be looking at your hips. For this, I am also going to have you stand for this. I'll help support you. Okay, so with the hips, we are going to first look at flexion. So we can start on the left side. I'm going to have you just bring your knee up like this and flex that hip. So bring your knee up, flex the hip where you can relax. Very good. I'm going to have you kind of kick your hip behind you, okay? And we're going to check extension. So extension, very good. All right, and we're gonna now check adduction. So you're gonna bring your hip out. Adduction, abduction, bring it in. Very good. We're gonna do external rotation first. So you're gonna just point your hip out this way. Very good. And then you're gonna do internal rotation. Very good. Now we're gonna do the same thing on the right side. So flexion up, good. We're gonna do extension back. Very good. All right, and you can bring it back to the midline. We're gonna do adduction out, abduction in. Very good. And then we're gonna do external rotation, internal rotation. Very good, and you can relax. All right, you can now have a seat. We're gonna check your knees. Okay, so for your knees, we're just gonna do extension, which is bringing your leg up for me, extension, and flexion, you're gonna just bring your knee back down. Very good. Same thing over here, extension and flexion back down. All right, you can rest your leg up here for me. We're gonna look at your ankle. I'm gonna take off your shoe, okay? So for this, we're looking at your ankle. So we're gonna have you dorsiflex. So you're gonna bring your foot all the way up to your head. Very good. Dorsiflexion right there, and then we're gonna do a extension. So you're gonna point towards the ground. Very good. All right, now I'm gonna have you do inversion. So you're very good, and eversion towards me. Very good. We're gonna check those toes. So we're gonna bring your toes up. Very good, and then point your toes down. Very good. Okay, I'm gonna just check the strength here while I'm here. Go ahead and push like a gas pedal. Very good, and pull me towards you. Very good. All right. All right, and while I'm here, go ahead and lift your knee up. Very good. Okay, good. Put that over there. So we're gonna do the same thing over here. You can rest your leg upon my leg. Very good. I'll take this off. All right, we're gonna do some dorsiflexion. So we're gonna go to your head. Very good. We're gonna do extension down. Very good. We're gonna do this. We're gonna do inversion towards me, eversion towards the wall. Very good. And then we're gonna do your toes. So toes towards you, toes down to the floor. So that was flexion. Excuse me. That's flexion. Flexion and extension down to the floor. Thank you. All right, well, let's check your strength. Go ahead and push on the gas. Pull towards you. Very good. All right, and again, we're gonna check the strength in your knee. Go ahead and pull up to the ceiling. Very good. You can relax. All right. The one thing that I did skip that I want to go back to is your fingers. So I'm looking at your fingers and I want you to, they're fully extended right now. I want you to flex them in. Very good. Extend them again. All right, and then what I'm also going to do is we're going to do adduction. So when your hands are like this, I'm going to have you just splay them all the way out, adduct them. Very good, and then abduct them, pull them all the way in, just regular, just flat. Very good. That looks great. And you can relax. All right, that concludes our test. Do you have any questions or concerns today?
No.
Thank you.